A cruise ship in the middle of Atlantic and a virus that most people have never heard of suddenly kills passengers on board. 3 people are dead. More are hospitalized across multiple countries. And right now, even a month after we first heard of this hantavirus, governments are still scrambling. Passengers are in quarantine. And your phone is probably full of headlines saying what you need to know about this hantavirus. Is this the COVID virus? In the next few minutes, I'm gonna tell you everything you actually need to know about the hantavirus, what it is, what happened on the ship, and whether you should be worried and what you can actually do. No panic, just facts. Let me start by how it started. On April 1st, 2026, a cruise ship left Argentina for an expedition to a Dutch. It carried passengers from across 23 countries. But one passenger had unknowingly brought something dangerous aboard. A Dutch traveler who had spent months in traveling in remote parts of South America was likely infected with the hantavirus. He was likely exposed to infected rodent droppings or contaminated dust. At first, he was completely fine. Then passengers started getting sick. Fever, muscle aches, breathing problems. At first, it just looked like the flu, but by May 2nd, WHO was alerted. 2 passengers were already dead. Another was critically ill. Lab tests confirmed the cause, hantavirus, specifically the Andes strain. Right now, there are 10 confirmed and probable cases of the hantavirus, 3 deaths, and quarantine across multiple countries. A virus most people had never heard of is making headlines across the world. It's not something that comes up in everyday life, folks. Hantavirus is not a single virus. It's a family of viruses. Think of like how flu isn't just one thing. There are many strains of flu. Same idea here. These viruses live in rodents, wild mice, rats, moles, but the rodent itself feels completely fine. It carries the virus, but does not get sick. But when a human comes in contact with the infected droplets, urine, or saliva, that's where things can go wrong. You don't have to touch the rodent. Remember, just breathing in dust from dried droppings in an enclosed space can be enough. Scary, right? Now, once it gets to a human, it can cause 2 main types of disease. It can specifically attack your lungs or attack your kidneys. The first one that attacks the lungs, it causes something called the antivirus pulmonary syndrome. It starts like a flu, like all others. Fever, chills, muscle aches, but around day 4 to 10, it can suddenly attack the lungs. You can have severe difficulty breathing and it can deteriorate really fast. The other variety is more common in Europe and Asia. The same family of virus tends to attack the kidneys instead of the lungs, and we call it as the hantavirus hemorrhagic fever with renal syndrome. It just means that it has bleeding, and we do have kidney failure in this kind of involvement, but it has low death rates than the one that attacks the lungs, but still serious. Regarding treatment, there's no specific treatment for the hantavirus. No antiviral drug we know so far, no vaccine yet, which is exactly why early supportive care matters so much. If someone gets to a hospital early enough with oxygen support, with ECMO in severe cases, survival can go up to 80%. Timely identification is everything in hantavirus. Now, here's the key number I want you all to remember. Among patients who develop the severe respiratory symptoms, about 38% die. That sounds terrifying, right? The question everyone is asking now is this the new COVID? I want to answer it directly as a doctor. No, this is not the next COVID. And here are 3 specific reasons why. Number 1, we already know this virus. Hantavirus has been known to us since the Korean War in the 1950s. Scientists have been studying it for decades. This is not a mysterious new virus at all. we know how it behaves. Number two, it does not spread easily between people. You got to remember this fact. It does not spread easily between people. Almost every single case of hantavirus in history has come from direct contact with rodents or their droppings. The Andes strain, the one on this ship, is the only exception. And even it requires close, prolonged contact with a symptomatic person, kissing, sharing utensils, and extended time in the same enclosed space. Those are the ways it can be transmitted. Casual contact, like sitting near someone or passing them in a hallway, that's not how it spreads. And number three, this virus does not mutate rapidly. COVID was dangerous, folks, because it kept changing. We heard new strains coming every day, every week, new challenges. Scientists who analyzed past Andes virus outbreaks found that the virus remained genetically stable. The WHO director said it clearly last week, and I want you to hear this. This is not the start of something like COVID pandemic. This spread it's very, very differently. And one more thing, in the entire United States, across 30 years of tracking, there has been fewer than 900 confirmed cases of hantavirus total in 30 years of tracking. So who actually needs to be concerned right now? If you were on the ship, most likely you weren't, or were in close contact with someone who was. Yes, you should be in contact with your doctor immediately, and you will need a quarantine or a monitoring period of around 42 days. That means a quarantine of around 6 weeks. If you live or work in rural areas, especially if you are cleaning out closed old spaces, barns, sheds, cabins, storage rooms, and you see signs of rodent, you need to be careful. This is your relevant risk. And for everyone else, that is for the vast majority of people who are watching this, your day-to-day risk is extremely low. So the authorities have been clear, and let me re-explain this to you. Routine travel can continue. No need to change your plans yet. The people in serious danger were in a very specific, very unusual situation and enclosed weeks of close contact. One infected person in the middle of it at all. I don't want you all to panic from the hantavirus. This is so much important. Look, I understand why this story is making people nervous. A mysterious virus, a cruise ship, and death across multiple countries. Those headlines that pop up every morning, they're designed to make you anxious. And I was anxious too the first few weeks, like what's going on there? But anxiety without information helps no one. What I want you to walk away from this video is hantavirus is real, it is serious, and this specific outbreak is being actively managed by the healthcare authorities across the world. But for a majority of people like us, including you, me, the risk is very low. You don't need to panic. You need to be informed. Thank you so much for watching this video. Follow eHealthyinfo for more facts like this. We got you.